will be providing us with an update on the COVID-19 projections. And following his presentation, I will offer some remarks and reflections on our recent numbers as well as the modeling that he will present. Before I turn it over, I just want to sincerely wish everyone a happy Pride Month. And with that, I will now turn it over to Dr. Brown.
Thank you, Dr. Yaffe. So I'd like to start as well by wishing everyone a happy Pride Month. After the Stonewall riots of 1969, Pride started as a way to respond to shame and hatred with cohesion, joy, and pride in oneself and pride in one another. And the growth of the Pride movement is one of the gifts that the LGBTQ2S+ communities have given Canadian society. That message of cohesion is extraordinarily timely. Even as we focused on the tragedy of COVID, our communities have been suffering from acts of hatred in London, reminders of the tragedy of residential schools, homophobic assault recently here in Toronto, and from other acts of violence and discrimination. I hope that the success that we're having with COVID now is a reminder of the good that we can create if we look up and we act together. So I talked about the success. Our cases are dropping dramatically now. And that's because of your decisions, like vaccination, like staying the course on the public health measures. The last 15 months have been incredibly challenging. That's true almost everywhere in the world. But I believe we should give thanks for the sacrifices that many Ontarians have made. And because of them, we've turned the corner in our progress against the pandemic. The modeling we will share today suggests that, with a few points of caution, we can look forward to a much better summer. We have made strong progress on vaccination, and we can point to falling hospitalization rates and to declining ICU occupancy. To be clear, we're not out of the woods just yet. Our ICUs still have more COVID-19 patients than they did at the peak of the second wave. The Delta variant, what we also call B16172, the variant that hit India so hard, is here, and it is on track to be the dominant form of the virus this summer. But we believe we can control it with the right actions. We are now suddenly one of the world's success stories for first-round vaccines. But we need to get more vaccines out quickly, and we need to move quickly into second doses to help fight the Delta variant. Our hospitals are still stretched. But as the numbers drop to more and more manageable levels, we'll have to start rebuilding our society and its institutions, not just to repair them after so much loss, but to make them better. There'll be a lot of disagreements about how to move forward, but from what I've had the privilege to witness over the last year, it won't take too long for 15 million Ontarians to find themselves pulling together and moving forward together. So before moving into the results today, which are mostly good news, let me start by thanking you for our progress. And now, let's get into the numbers. My apologies as the slides go up. You will actually lose the sign language translation, but it will be back immediately afterwards. Great. Let me start with the key findings. Cases, percent positivity, and hospitalizations have all dropped sharply thanks to the commitment of Ontarians. And these drops in cases and other indicators should continue to decline for at least 10 days and potentially for the summer. As vaccination continues, it will be important to monitor carefully for new variants and to continue assessing for signs of breakthrough infections. Those are infections in people who have already been vaccinated, and serious infections that result in hospitalization or other negative outcomes. The Delta variant is more transmissible and may be more dangerous. It will likely be the dominant form of the virus this summer. It is critical to control the spread of this variant. To help avoid a fourth wave, we need to continue to ensure first and second doses in high-risk communities. We need to make sure that our vaccine efforts are tailored to community needs, and we need to ensure the core public health functions of strong testing and case and contact tracing. And there is also our own choices in this. It's our choice to get vaccinated. It's our choice to get tested if we're sick. It's our choice to follow the remaining public health measures, like wearing a mask indoors. It's the combination of vaccination, strong public health capacity, and these choices we make that will be our key to a good summer and maintaining progress throughout the fall. You can see here that we've made substantial progress in case numbers. We are down to 2 public health units that showed increases over the last reporting period since the last briefing. We reported, I think, 590 cases this morning, at least when I last looked. And you can see that in almost all of our public health units, cases have decreased over the last 3 weeks. You can see here as well that percent positivity, the percent of tests that come back positive for the SARS-CoV-2 virus has declined sharply since the last briefing. You can see here in this slide, based on data from yesterday, we're looking at a 7-day average of 3.2% of tests. That 7-day average has now dropped to 2.6, and really we see 2% today on the point estimate. So positivity has come down, cases have come down. The only other note I'll make on this slide is that we still see high positivity in some communities, even those where testing volumes are declining. Case volumes are declining. And testing has declined as well. When we see cases down, we sometimes worry if that's a function just of the volume of tests. However, when we see cases down and positivity down, we tend to see that as a real decline in cases. With lower testing, we will miss some cases, but we believe the trend is very clear here towards lower cases, lower infection, lower transmission of the disease. But it's important to note that continued strong monitoring through a variety of channels will be critical for control of the pandemic. It's critical that we maintain eyes on the pandemic as we move forward into what is hopefully a good summer. And one more piece of good news here. This is the COVID-19 hospitalizations and ICU occupancy slide that we show every briefing. You can see that hospitalization rates and number of patients in hospital right now with COVID-19 has declined sharply. And has continued to decline over the last several days. That's excellent. You are now at a 7-day average of about 45 to 50 admissions per day, which is much lower than it was at the peak of the third wave. It's important to note here as well that ICU admissions have come down substantially. ICU occupancy has come down substantially and has come down quicker than after the second wave, which is good news. Important to note here, though, that ICU occupancy is still higher than it was at the peak of the second wave. So the direction of all the indicators and the numbers we're reporting today are excellent. There's still some challenges, but this is excellent progress. And maybe one more piece of good news before we get into the projections. You can see here rates of surgery compared to what they were pre-pandemic. The red line is the most serious or the most urgent type of surgeries. The yellow line is the next most urgent category of surgeries. And the green line is the least urgent category. You can see that for the last several months, the red line has maintained itself above what we saw pre-pandemic, which is good. That means access to the most urgent types of care is continuing. You can see that semi-urgent surgeries dipped down below the level of pre-pandemic in the last wave, during the third wave, but that has now almost come back up to that dotted line. That dotted line is parity with the pre-pandemic period. And the green line, the least urgent category of surgeries, has also come up. So we're seeing improvement in access to care here, and this is critical to controlling and reducing the access to care deficit. But you can see all the lines either at or are starting to approach where they were before, and that's good news. And here are our projections. There is a lot of uncertainty about these projections right now because we are coping with the Delta variant. We're looking at reopening during the summer, which means that more things can be outdoors. And we have a much higher level of vaccination than we did the last time that we opened during the summer. But before I go into what these different projections mean, I want to just say thank you. This is the hard work of Ontarians. It is the hard work of people making sure that people get vaccinated. It's the combined effort that's taken us here. So if you look right now, we are tracking well along our green or slightly below our green line, which prior to this briefing was sort of our best case scenario. You can see that we're still tracking along this line now, which is excellent. And we're most likely right now either in yellow or green, but I think if we had to put a balance of probabilities, we'd say on green. And so you can see as this line comes along here, we're starting to move towards a better and better summer. A couple points I want to make on this sheet. First, vaccination, increasing vaccination from about 140,000 vaccines a day to about 180,000 vaccines a day does lower any curve that we look at. And so continued progress and even acceleration on vaccination is important. Second thing to note is that the red curve, that is a highly unlikely curve. That is a curve where we see a 100% increase in transmission, does lead to an increase in case numbers, but that is a highly unlikely curve. So I said before, the yellow curve, which is about a 75% increase in transmission, or the green curve, which is about a 50%, are much more likely. And right now we're tracking along, or just slightly better than the green curve. So you can see here a positive outlook, but it's important to maintain progress on vaccination, and anything we can do to increase that will increase our success with the pandemic. And it does mean it's important still to curb transmission. And so as public health measures are lifted, please make sure that you adhere to the ones that remain to help curb that transmission until we are fully through getting the Delta variant under control. I'll go now to the COVID-19 projections around ICU occupancy. And you can see here that under almost all of the scenarios, we get down to about 200 COVID-19 patients in our intensive care units by mid-July. That's when we can sort of start to begin what we'd sort of say is almost normal hospital operations. It's important to note that all of the curves take us down here on ICU admissions because ICU admissions are a lagging indicator of COVID-19 cases and COVID-19 infection. It takes a period of time for people to become ill and for them to become seriously ill enough to enter into the ICU. So you can see just at the tail end of this chart around the middle of July, you do start to see the red, yellow, and green lines diverge. If we stay on the green line, you'll see ICU admissions continue to drop down, and that's very good for our health system. It's very good for access to care. On the yellow line, if we see higher transmission than perhaps we might expect, you will see it start to flatline or maybe increase slightly. And you can see the red line just on that chart there does start to curve up a little bit. But again, we're expecting yellow or green, and we're hoping for green on this. Now I want to spend some time talking about the Delta variant. The concern over the original variant, the B.1.1.7, or what's now called the Alpha variant, is that it was much more transmissible and more virulent than the original strains that had come into Ontario and into Canada. We see that increased transmissibility with the Delta variant as well. It is about 50% more transmissible than the Alpha variant. So the Alpha was about 50% more than the original strains, and now we're about 50% more transmissible again with the Delta variant. That's how it becomes the dominant strain over a relatively short period of time. It will likely be the dominant strain, regardless of our case counts, by the summer. And we believe, based on early data, that the risk of hospitalization when you are infected with this variant is increased. Next point that's really clear, and I want to take us to the graphic over on the right-hand side of the screen. Vaccine effectiveness is lower with the first dose with the Delta variant. And so if you think that in 10 people, after the first dose, about 6 of them are protected against the Alpha variant, or won't get sick from that. And after the second dose, another 3, so for a total of 9, won't get sick after that second dose. The Delta variant, the percentage being protected against that serious illness, against that illness, is lower after the first dose. It's only about 4 out of 10. And so you can see with the Delta variant, there's about a 50% absolute increased protection after that second dose. And so continuing a strategy that focuses on high-risk communities and age will help control the spread and the impact of the Delta variant. And what we mean by this is that we need to make sure that we protect all regions with a first dose to avoid those pockets of low coverage. This helps reduce the risk of the introduction and propagation or transmission of the Delta variant. Of course, even with any type of vaccination approach, it's important to maintain the core public health functions. But what we believe as well is that protecting regions at high risk of Delta with high rates of cases is important with increased first and second dose coverage. This helps control surges in these Delta high-risk areas. And importantly, I think as well, it helps minimize the risk of spillover into other communities. And so sometimes I think we feel that we may assume that we're only protecting people in high-risk communities. actually, this sort of combination of age and high-risk communities does drop overall case counts by about 40% when we get the second dose eligibility at 6 weeks. But much of that reduction is actually in cases in non-high-risk communities. And so they protect the high-risk communities, but they also protect the entire province. And just so there's a little bit of a technical note here. When we're modeling this, we're comparing a pure age-based allocation against the continuation of a high-risk community strategy, so that under the high-risk community strategy, about 45% of people in high-risk regions would be vaccinated by the end of June. About 25% people in non-high-risk communities or high-risk regions would be vaccinated by the end of the June, and hopefully 70%, which we're really getting very, very close to in any sort of community that we look at now. Let me continue on with a picture of vaccination. You can see the vaccination coverage continues to increase. You can see in the total population of people 80 years and older in the province, almost everyone in that total population, including long-term care homes, now has at least a first dose of a vaccine. But you can see progress along all other age groups here, including in the youngest age group, the 12 to 17 years of age. We're going to go to a slightly different picture here. We've shown this chart before. This is a slightly different picture of vaccination here. This does not include long-term care home residents. So it does not include people who have been vaccinated in long-term care homes. And you can see, if you look at that top row, that actually the percentage of people who are living in the community who are 80 years and older is lower who have been vaccinated. And that's because these are folks who have not gotten or not been able to get to a vaccine clinic. It's people who may be homebound. But when we just look at people in the community and don't look at people living in long-term care homes, you can see that that proportion is much lower. And it's an important area because their vulnerability to COVID-19 to get vaccinated. You can see that parity has increased across a number of different age groups, with high-risk communities having similar and at times higher rates of vaccination than low-risk areas. However, if you look again at the upper left-hand corner of this chart, you can see that the older population in the highest risk areas actually have had less vaccination than the older population in the lower risk areas. And obviously we want the level of vaccination to be higher in those highest risk areas. This is likely requiring different techniques, mobile vaccine clinics, working with primary care, other ways of reaching people to make sure that they are vaccinated, particularly in these very vulnerable groups. That takes us back to our key findings. It's clear that cases, percent positivity, and hospitalizations have all dropped sharply, and that's thanks to the commitment of Ontarians. Cases should continue to decline for at least the next 10 days and may continue to decline for longer. As vaccination continues, it will be important to monitor carefully for new variants and to continue assessing for signs of breakthrough. Those are infections, those are people who have been vaccinated already but somehow become infected, and signs of serious infection. The Delta variant is more transmissible and may be more dangerous. It will likely be the dominant form of the virus this summer, and it's critical to control the spread of this variant. And to avoid a fourth wave, we need to continue to ensure first and second doses in high-risk communities. We need to continue tailoring vaccination approaches to community needs, and we need to ensure strong testing, case, contact tracing, and surveillance or monitoring of the disease as we move into the summer. I'll just stop here to actually take a few minutes to note the contributors to this report, to thank them, and to thank all of the colleagues from across the province who've worked on the modeling consensus tables, on the science advisory table and its working groups, or on the evidence synthesis network. Dr. Yaffe?
Thank you very much, Dr. Brown. Since the last update on Monday, we in Ontario have reported an additional 1,470 cases of COVID-19. Broken down by day, we're looking at 469 cases on Tuesday, 411 cases on Wednesday, 590 cases today. While today's daily case number is somewhat up from recent days, we do typically see a rise midweek. So this is not entirely unexpected. And the 590 cases today are well below what we saw last Thursday when we reported 870 daily new cases. Ontario's 7-day average continues to decline steadily and is currently at 617. The 7-day provincial case rate is now 38.1 per 100,000 population, and this is down about 32% from last week's data. We do continue, as Dr. Brown said, to see improvement in the number of hospitalizations and ICU admissions. Today, there are 516 people in hospital with COVID-19, 450 in ICU. We know that 24 of the people in ICU are from Manitoba being cared for in our hospital, so the actual number of Ontarians in ICU is 426. Sadly, we are reporting an additional 62 deaths since Monday's update. This includes 11 COVID-related deaths today. We extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to all those mourning the death of a loved one in these difficult times. In terms of testing, 31,423 tests were processed yesterday. And for the second consecutive day, we have recorded a positivity rate of 2%, which is the lowest we've seen since mid-February. Positivity rates continue to decline week over week, with the current 7-day average at 2.7%, which is down from 3.5% 1 week ago. In terms of vaccination to date, more than 10.6 million doses of COVID-19 vaccine have been administered in Ontario, including 182,350 doses yesterday. So we're now averaging about 160,000 shots per day, which is a tremendous achievement. This translates into 73% of adult Ontarians with at least one dose, and more than 11% who are fully immunized. As Dr. Brown noted, cases, percent positivity, and hospitalizations have all dropped. These trends are because of your continued efforts to adhere to the public health measures, because you are rolling up your sleeves to get vaccinated. And those efforts mean that we are cautiously moving into step 1 tomorrow. And while we may have reached the point where we can enter step 1, I do want to take this opportunity to remind everyone that we must continue to be vigilant and make careful choices. Enjoy dinner on a patio and an outdoor fitness class, but do so safely. Continue to adhere to the public health guidelines that will keep you and those around you healthy and protected. And I want to encourage all Ontarians who have not yet received their first dose of vaccine for COVID-19 to do so as soon as possible. And for those who have received their first dose, to get your second dose as soon as you are eligible in order to ensure maximum protection against COVID-19. And with that, I'm going to turn it over to the media for questions. Thank you.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
John McGrath, TVO.
Good afternoon, doctors. Dr. Brown, one of the questions that's been going around at the moment is the issue of the dose interval on AstraZeneca. People who got the AstraZeneca shot are still waiting 12 weeks in Ontario versus 8 weeks or less in other jurisdictions. From the perspective of, getting those second doses in arms and the sort of the population health perspective here of trying to reduce or minimize the risk of a fourth wave, is there what in your perspective should the government be doing? Should we be accelerating the dose interval for AstraZeneca?
Well, I might let Dr. Yaffe answer that first, and then I'll come in after if there's
Thank you. Thanks for the question. I would say that this is under very active discussion currently at the ministry. With respect to AstraZeneca as the first dose, we know from the literature that the best protection from the second dose of AstraZeneca occurs at about 12 weeks interval. There is less data with respect to getting an mRNA vaccine as the second dose. There are studies showing with 8-week interval, 10.5-week interval, and so on. So we're very actively looking now at the data with Public Health Ontario and actively considering the intervals for those individuals.
And maybe the only addition I'd make is that it's really important to make sure that as much as possible we accelerate second doses, and so anything that is safe that we can do there is positive.
Follow-up?
Dr. Jaffe, on testing, I mean, this modeling briefing did say that, testing levels are down, and as much as positivity is also down, I think that, I look at Nova Scotia, which just had some really, I think the highest level of testing that any province has seen in the pandemic, and they seem to have that seems to have contributed to really shutting down their latest wave. So, why aren't we testing more right now?
I would say, there are still many, many thousands of people being tested every day. And we certainly encourage anybody who has any symptoms suggestive of COVID-19 to get tested. We are doing asymptomatic testing, certainly of people who are working or visiting long-term care, retirement homes. I know we're sending out rapid antigen testing to businesses. So there's certainly a lot of push for testing. But I think, testing is only one part of the armamentarium. You have to have good case and contact follow-up. You have to have good, obviously, vaccination and good surveillance. So I think testing is just one part of the picture, but it's an important part.
Next question.
Stone at the Globe and Mail.
Hi there. Just following up on my colleague's question about AstraZeneca. Dr. Brown, I think we would like to hear more from you on this and what your specific recommendation for the Ontario government would be. I mean, we're trying to balance here the risks associated with the Delta variant, and there's evidence from what other provinces are doing that 8 weeks would be fine. So I think there's a lot of people who are feeling very frustrated right now that they're in the queue for 12 weeks when others are able to get their second dose faster. So what is your recommendation for what the Ontario government should do?
So we are looking at it right now. I don't want to come out with an opinion because I really try to rely on the advice of the whole table. I think our early look at it is that it could be shorter, and we'll make a recommendation and make it with government as quickly as we can. I don't want to give you an answer before that we've had the benefit of the whole table looking at it.
Follow-up?
Thank you. And just regarding the Delta variant becoming the dominant form of the virus, that's not. Can you put that into context for what that means for people with vaccination rates the way they are, the way that the cases are falling now? Does that necessarily signal a doomsday scenario, or are we going to beat this? I think when people see that, they're going to say, "Oh no, not again." Is this going to happen all over again? But that's not necessarily what you're saying, is it? Can you break that down?
No, you've got it exactly right. This is not a doomsday scenario. We believe that if we're able to follow, really continue a high-risk community-focused vaccination strategy, to do that really quickly and expeditiously, that we've got a good chance of controlling the Delta variant, and actually a really good chance of a good summer. When we say it's the dominant form of the virus, that means that it is the largest percentage, or accounts for the largest percentage of the cases, not that it necessarily is growing absolutely. The reproduction number for the Delta variant has been below 1 for a few days now. Now, it does jump around a little bit, but as long as we can keep it below, we'll do well. So it's not a doomsday scenario, and we can control the Delta variant with the right actions.
This is the last question unless someone else joins the question queue.
From Rob Ferguson, Toronto Star.
Hi, just for Dr. Brown here, I guess, and Dr. Jaffe, feel free to weigh in. I was looking at the BBC website today, and the cases of of Delta there are up 63% in the last week, or all cases, sorry, which are mostly 90% Delta. And they've gone up to about a little over 7,000. So how can we learn from that? Do you have any insight as to why they've taken off so much there when they do have a pretty high level of vaccination, and how that would look here?
Barbara, Dr. Yaffe, you mind if I start?
Go ahead.
So there's a very sort of particular pattern in the UK data where these sorts of explosions of cases are happening in communities with lower levels of vaccination. Now, the UK has I think, slightly lower level of first vaccine dose than we do, but a higher level of second vaccine dose. So we may have some protection from our higher level of vaccine dose. But they're really taking off in unvaccinated communities. And so I think this is the reason it's critical to try to both get that first dose into as many people as we can across the province, and accelerate that second dose into high-risk, high Delta risk communities, so that we actually protect against that sort of surge that we've seen in the UK. While there has been a substantial growth in cases in the UK, the growth in hospitalization looks to be somewhat moderated or lower than we might have expected, which is probably an indication of vaccination and of other factors. And that really kind of just brings it back for me about the importance of making sure that we get as many people vaccinated with the first dose as fast as we can, and making sure that we have as many people in the high-risk areas get their second dose as quickly as we can, so that we don't have places of vulnerability like the UK has.
This is the last question.
Yeah, thank you for that. Very, very much appreciated. And Dr. Yaffe, can you give us any more detailed insights into the people going into hospital now with COVID? On Monday, I think it was you or Dr. Williams said by far they are unvaccinated or recently vaccinated. Do you have any percentages or any kind of better indication of what that is?
Actually, I don't have the specific data on that. I know that's something of interest. In general, we know that the majority of cases are people who have not received any vaccine, or maybe have received one dose within a few days. As we all know, it takes at least 2 weeks to develop immunity, longer in some people, particularly older people. And again, to get the second dose, to be fully immunized, you have to have had 2 doses, and you have to be at least, depending on which data you look at, 7 or 14 days post the second dose. So it's not unexpected that we would get some cases in people even who have had 2 doses. The vaccines are excellent, but they're not 100%. But those people tend to have milder cases and less severe cases. Less of them tend to be hospitalized. I just want to make another comment on the last question. I do think it's important to learn from other jurisdictions and look at the experience. The UK tends to be a few weeks ahead of us, so we're looking at them. And I sit on a federal, provincial, territorial table. We just had a presentation from Israel about their experiences. And we've had one recently from the UK. We look at the literature. So it is important to look at how others have dealt with it and what they have learned from it. But the bottom line is, for everybody, we want to get out of this. We want to have a good summer, and you need to get your vaccine. That's the bottom line.
Thanks, everyone.